I am very passionate. So I am passionate about diabetes again because I've just known so many people that's like been affected by it, including my late mom who was one of the patients that kind of was like, I'm feeling okay, even though like her blood sugar was really high, and then ended up subsequently having like consequences from it. And ended up having a stroke ultimately. So yeah, so that's kind of why I'm here. I am going to let Otis kind of talk a little bit about his experience with diabetes. Feel free to mention anything you want to, and then if you're okay with it, then people can also ask questions if they have questions about it.
Okay, thank you. Hi, everyone. My name is Otis Lovejoy. I've been diabetic for 16 years now. Um, it's been a long journey, but it is something that's manageable.
Yeah.
Early on, I found it really difficult. Um, Everyone I talked to told me that you can't eat this, you can't eat that. Only thing they did is give me a list of things not to do, but they never really told me how to manage it. They never really explained what it was. So for me, it was really difficult. Over the years, I've tried everything from changing diet. I lost about 70 pounds at one point. That still did not get my numbers under control, but it did get me on a better trend. I've had pills. I've been on insulins. One thing I've learned over the time is that it's possible that you can find a medicine that works for you, but over time, your body can get to the point where it kind of rejects the medication. Then they need to make a change. So I've been through a little bit of all of that. And right now, my numbers are fairly good. And my A1c currently is at a 6.4. Now, previously, I have A1Cs as high as 14. So that's a substantial drop right there. Now, along the way, I've learned a lot of things. Managing diabetes, believe it or not. You know how they say it takes a village to raise a child? It takes a village to maintain diabetes sometimes, because sometimes you need someone to help keep you accountable, or you need people around to recognize the signs when you're experiencing highs or lows. For me personally, I experience both highs and lows. I naturally run high. And when I say run high, when I'm not on my medication, I'm easily in the 300-400 range with ease. Um, Now, when I'm on my medication, there's times when I'm running right around 70 to 120. There's other times when I've dropped as low as 40. And that can be pretty scary because, you know, it's just if you're not aware of what's going on, you may not recognize the signs. And sometimes those minutes are very crucial. Uh, for me, when I start experiencing lows, a lot of times I'll get sweaty. I'll feel really nervous and jittery, kind of like I'm shaking on the inside. Sometimes it's even visibly so people around can see it. Other times it's just inside, it's kind of like a tremor. Um, Also, I experience brain fog. I can't think straight. And I'll go to pick up my cell phone to check the time, and I pick up the phone and I'm wondering, like, now what was I going to do? And it's just something that quick, something that should just be second nature. When you're experiencing those moments of brain fog, it takes so much longer to respond. And even your regular day-to-day tasks. You know, I can go outside and mow my grass one day and I'm completely fine. I go outside and mow my grass another day, and seriously, I'll feel like I'm about to pass out. Now, just because one person responds like that doesn't mean that's necessarily going to be the way another person responds. So, having diabetes, you got to get used to yourself and learn the signs and see how your body is going to respond. You could notice that it could be a little bit of mood swing. You could get grumpy. You could get angry. Um, I personally have not gotten happy, but hey, who knows? To each their own. But anyway, though, a lot of it is just learning what signs to look for and learning how to manage it. Um, like I said, it is something that is manageable. One thing that a lot of people don't emphasize enough is getting green vegetables in your diet. Um, I was one of those people that I felt like just because I was eating 3 times a day, that was good enough. But to be honest, what my doctors recommend is eating more during the day. One dietitian told me they like to see me having 6 small meals that are more like snacks versus actual meals, and making sure that I'm getting fruits and vegetables in each serving. So make sure you get your fruits and your vegetables in, get the green vegetables, the leafy stuff that no one seems to like. I like to refer to it as rabbit food, but it's really very important that you get those things in. When you don't have that in your diet, you can really tell. You can tell whether it's a difference in texture of your stool, or you can tell in the scent of your urine. So if you're diabetic, a lot of times the early signs that people notice is that they're urinating a lot, or they have constant dry mouth. It's like they can't quench their thirst. So again, when I mentioned the urine, it sounds like something you don't want to discuss, but it's something that personally you may notice because of the fact that you're going so much, and then all of a sudden you realize that there could be a change in color, or a change in frequency. So those are signs to recognize. Now I feel like I'm rambling, so at this point, I'm just going to stop right here. But if anyone have any questions, I'll be here to answer them.
That was really good. Thank you for sharing. I really appreciate that. Anyone have any questions for Otis? Okay, I'm just kind of checking in the chat too. No. Okay. Well, if not, thank you again. And
We can't hear you.
thank you. I appreciate it. Hopefully you guys heard some of what I said. No, none of it. I was saying thank you for sharing though. We really appreciate you sharing that information. And I was just saying, if no one had any questions, then I'll go ahead and like start my PowerPoint. So give me just a second. I'm just going to figure out how to share my screen. And Tiandra, I don't know if you have to give me any like sharing rights. Okay, perfect. I see it pop up. All right. Let's see. I see my screen. Okay. Can you guys see my screen or no?
No.
No, not yet.
And after you do it, if you could make me the host again, because I lost privileges.
Sure.
Thank you.
Hopefully this, can you guys see this?
Yes, ma'am.
Perfect. 1 second. Let me move this out of my way here. All right. Still good?
Yes.
Yes.
Okay. Perfect. All right. So this is just the intro slide here. Just a second. And I'll actually let Jamisha, who is like the mastermind behind Generational Health, actually just introduce the organization, if she would.
Hey everybody, I'm Jamisha Ford. I'm a PGY2, meaning second year resident up here at Cleveland Clinic. Our mission is, as it's stated on the screen, to create a culture that welcomes and openly discusses medical care so that our communities can prosper throughout the generations, creating generational health. I've explained this numerous times to those people who come regularly. You guys have heard it, but for those who don't, my family experienced a number of deaths last year, in deaths that us as medical or health professionals would deem as preventable. And so with that, I was inspired to create a series, if you will, of true medical stories to help prevent deaths or preventable deaths in other families. So I'll hand it back over to Armika and let her continue with
Okay,
the talk.
sounds good. Okay. So I'm just going to go to the next slide. So first of all, of course, we know we're talking about diabetes. So I just wanted to start off with like some names that you guys may hear. These are some that I've heard from people just over the years, and then some I've just heard more recently. So people are known as the sugars. I feel like that's kind of at the top of the list there. Some people call it sugar diabetes, the sweets, the beatus, bad blood, and then some people just say I'm sweet. So do you guys happen to know of any other names that people refer to diabetes as? No, kind of looking for something to pop up in the chat. No? All right. Well, I'm gonna go to the next slide then. So here are a few facts about diabetes. So there are 34.2 million people that are affected by diabetes, like in the United States. And the number is like progressively increasing, basically as obesity rises. So, and then 1.5 million Americans are diagnosed every year. And then if you don't actually have diabetes, 1 in 3 people are pre-diabetic. And we'll kind of talk about what pre-diabetes, like what it actually means. So there's 2 different types of diabetes. Type 1 is autoimmune. So that basically means that where insulin is made, which is in your pancreas just cannot make the actual insulin. And that's because your body is almost like your body's attacking itself. It's attacking the cells. It's saying, hey, we don't like that. Let's get rid of the cells. And then for whatever reason, your body cannot actually make the insulin. Type 2 is the one that a lot of people are more familiar with, and it is representing like that lifestyle. Sometimes there's different risk factors for it. It could be obesity, high blood pressure. There's a lot of things that kind of go into it, which I'll actually talk about, like some of the risk factors for diabetes. But again, that's one that's like diagnosed later in life, and it's kind of related to lifestyle changes. So, and diabetes itself is like one of the major causes of blindness in the United States, as well as kidney disease. So here are just some of the terms to know. And these are terms that a lot of people talk about, people with diabetes or without diabetes, if they know anything about the condition. These terms are thrown around all the time. So hyperglycemia is a term that's used, and it just means when your blood sugar itself is high. And so high can be like anything, sometimes around 100 or like above, and kind of depending, that number kind of varies depending on whether you've had anything to eat at all, like all day, or which is called like the fasting glucose, or whether you've actually had something to eat within the last couple of hours or so. Hypoglycemia is on the other end of the spectrum, where you have low blood sugar, and that can be somebody that's blood sugar is below 70. So hemoglobin A1c, a lot of people hear this, and actually Otis kind of referred to it. It is that number that's representing how you've been doing the last 3 months with diabetes. It shows, has your actual blood sugar been within whatever range that you're looking for it to be in. Pre-diabetic is where the person doesn't actually have the diabetes, but you can see that their number, and that's based on that hemoglobin A1c, their number is actually higher than it should be. And so to be in that pre-diabetic range, that's having like a hemoglobin A1c between like 5.7 to about 6.4. Otherwise, if you don't have like diabetes, not pre-diabetic, your number should be below 5.7. And something else I want to talk about was complex carbohydrates, because people hear about like carbs all the time, and carbs can be in the form of like the foods that you eat. It would be more like the breads that you eat, different like candies, pastries, all of those things. But the complex carbohydrates are the ones that doesn't make your blood sugar actually just go like through the roof all at once. Because we know if we have like a sugary drink, like say a soda or something, your numbers can just go really high. But if you have the complex carbohydrates, it could be something like oatmeal, just something high in fiber, like whole wheat breads, where the actual glucose number, that sugar number, is like evenly distributed. So you don't have that spike. It just kind of like slowly leaves your system, which is the best kind of carbohydrates for you. And so here's
we just got a comment in the chat.
Okay, and I actually cannot see the chat, so if you can read it to me.
Yeah. Can you explain a little bit about what the A1c is actually measuring?
The A1c? Sure. So A1C, it's like you have your red blood cell, and it's showing the amount of, almost like the amount of sugar that's on those red blood cells. And so that kind of shows, again, how much actual sugar is like in your bloodstream and circulating for, and it's usually for 3 months. And we say 3 months, which is why like diabetics say go and get a check every 3 months, because that's how long red blood cells live. So every 3 months, you'll basically regenerate these red blood cells. And depending on how much actual sugar you have in your blood, that will kind of show where your numbers are. Is that clear? I'm not sure for whoever asked that.
Yes, thank you.
Okay, perfect. So I told you guys, I'll talk a little bit about some of the risk factors. So some of them are being overweight or obese, being over the age of 45, having a family history. And then if you're African American, Alaskan Native, American Indian, Asian American, or Hispanic or Latino, you're increased risk. If you have high blood pressure, or if your good cholesterol is low or your bad cholesterol is high. If you're not physically active, so you're not like exercising on a regular basis. If you have depression or PCOS, which is polycystic ovarian syndrome, and that's not one of those conditions I'll really get into right now, because that's kind of loaded by itself, but that is one of the risk factors for diabetes. So I just wanted to talk a little bit about like how diabetes works. Before we can even talk about like diabetes, let's just talk about the regular system. So if you look at the picture, can you guys see my actual cursor moving too?
Yes.
Okay, perfect. So if you look at this picture here on the left, what happens is when you actually eat food, which is kind of represented by this little apple here, it goes into your actual gut. Your gut releases something which is called incretin here. And it's basically telling your pancreas, hey, pancreas, you need to go ahead and make insulin. And the reason that you're making insulin is that so you actually will have that sugar taken from your bloodstream up into your cells. These are the cells that are actually like physically going to your organs. So that could be like anything, your organs, your muscles, everything you need to move, the things that you need like to basically sustain life. And so it goes in there, and then you're able to either store it away for later, or you can actually like actively use it. And so this is kind of how the system works. You use the cell, you know, you have the energy that's kind of stored up here. When you're ready to use it, whether it's you're running like this person's doing here, just everyday like movement, walking, everything we need, just even to breathe, we need a little bit of energy. And so we end up using that. And then here you are, you have your energy, you're using it up, all is well. The thing with diabetes is that your pancreas, in the case of the type 1, is again, it's just not making that insulin. So that's why type 1 diabetics, they always have to use, like actually use insulin. They can't use any medication that's by mouth because their body is just isn't making the insulin. But in the case of type 2, your pancreas may actually still make insulin, but because you have like so much sugar actually in your bloodstream, your cells are not actually responding to the insulin. So what happens when your body doesn't respond to the insulin is that that glucose, that sugar just stays in your bloodstream. And this is like detrimental because you actually have so much sugar that it negatively affects your organs. And so your organs are like, okay, we don't really like that so much. And then they basically are starved because they don't have that energy going into them like it normally does. So that's when you come over to this picture here, talks about incretin. So if you have diabetes, one, where you're going into the gut system, you're not actually able to make that incretin. If you can't make that incretin, then you don't tell your pancreas to make as much insulin. So then you have less insulin that's made, which means you have more sugar that's in your bloodstream. So this basically starts like a really like vicious cycle practically as to what happens. Again, going to the liver, and this is just showing some of the organs that are affected. So your liver basically becomes more resistant to the insulin. So being resistant means that your body is like, no, I'm not going to accept this actual insulin that's coming my way. So because it's not accepting that, it can't take the glucose in, which again leaves you with more glucose or sugar like in your actual bloodstream. Same thing with muscle. And then like with fat, your fat will actually break down. So what happens with a lot of diabetics, and it's a condition called diabetic ketoacidosis, what happens is your body doesn't actually have the energy to use from the actual sugar. So it'll break down the fat and try to use that as energy. The problem with that is when the fat actually breaks down, it makes these things called ketones, which is like very dangerous for your body, and that can build up and cause a lot of problems. And so that is where we are there. The next slide is just going to show like the organs that are actually affected by diabetes. And so I'm sure a lot of people have heard about like the complications. Some of the main ones that people talk about in the organs that are affected like pretty soon after being diagnosed with diabetes and not controlling it is going to be your kidneys here, as well as your eyes. So what happens again with that glucose, that sugar that's like really high in your bloodstream, it will actually cause your blood vessels to not be as like, it's called elastic or move as much as it should. And so when it doesn't move as much as it should, in addition to having all of the sugar going to those organs, it really prevents the all of the organs to be able to function properly because they don't have the energy that they need and they don't have the bloodstream so that they need, like the proper bloodstream that's not like full of the sugar. And so here again, some of the organs that's affected, a lot of people hear about the diabetic foot or neuropathy. You'll feel like kind of that numbness and tingling, and that's all basically complications that comes from diabetes. It can cause your blood pressure to actually go up. You can, which can basically lead to a stroke. So there's a lot of details in this. I'm not going to get into it in lieu of time and just to not bore you guys. So anybody have any questions about this, what I talked about so far? And again, can somebody let me know about the chat?
We have a hand up from the Johnson family.
Sure.
You can mute yourself and ask your question.
Yep. Hi, Dr. Tatum.
Sure.
I have a couple of questions for you.
Okay.
So if a person is pre-diabetic, can they avoid becoming a full-blown diabetic or whatever the proper terms are by way of exercising and or whatever the doctor, whatever you all would recommend?
Absolutely. And actually, if I can answer that question just a little later,
Oh,
because
sure.
I will actually talk about it too.
Okay. And then my
Yes.
other question was, oh shoot, I had another question and now it lost me. I'll come back. I'll raise my hand in a minute.
Okay.
Thank you.
Yeah, sure. Were there any other questions or hands up like in the chat? Can somebody let me know?
And that was the only hand up. And currently we don't have any additional questions in the chat. I do have a question for you. And I'm going to be honest, it's going to potentially sound a little goofy, but
No. It's not goofy, girl. Go ahead.
Okay. So I hear a lot about this keto diet, right? So there's people that eat keto. Is there any relation to the, I guess, the mechanism of how you describe like ketoacidosis and how it comes about to keto diet in the same way that it works? Are they related at all? Or is there no relation?
Ooh, you know what? I'm gonna be completely transparent. I am not 100% certain. I have my thoughts behind it, but I'm like, I do not want to tell you the wrong answer. Any other docs on the line want to answer to that?
I can like work my way through this. So with the diabetic ketoacidosis that you were talking about with the increased sugar levels, the problem is that the body becomes acidotic, meaning that there's too much acid in there from the ketones, whereas the keto diet that's being used is more used as a therapeutic diet, and you don't have as many ketones in there to the point where it becomes dangerous or causes your body to become more acidotic, is what I would
I think my understanding of it is also that the
But hey,
ketosis
Dr. McCullough, it's kind of hard to hear you, at least on my end.
Can y'all hear me?
Yeah, Dr. Kashari, it sounds like you're
Can you hear me now? Yes or no?
no.
It's hard. Can you type it in the chat too, though?
Yes, please. And then we'll make sure to uplift it and share it verbally, vocally.
Yeah, sorry about that. We couldn't hear you. Yeah, and then also too, like the reason I just know like with keto, like the whole idea of like being in ketosis too is like you're burning, that is the energy that you're burning. So it's not like you're starving yourself too, as you are like with actual not having the glucose or the sugar that you need. You know, I don't know if that like makes sense, but yeah, that's a good thing for me to look up because I don't know that much about that diet. So
Excuse me. So
yeah.
this is something I'm recently looking into. I just spoke to a doctor about this.
Mhm.
And Miss Ford, the way you explained it was very similar to the way it was explained to me. Because what I was told was that it's basically the same process, but it's not as advanced as the ketoacidosis, where it's a bad thing. So the way you summed it up was about spot on. The way it was explained to me, it's the same process, but it's not as extreme, so it doesn't hurt your body.
Thank you, Otis.
Good. Thank you.
Really
We appreciate that.
Our Dr. Ford keeps us straight.
Keeping us together. Okay. And then
No
if
further questions currently.
I'm sorry, what'd you say?
There are no further questions currently.
Okay, perfect. And Kashari, if you want to put something in the chat, just let me know once it's up there. I'm gonna go to the next one.
It's up there. Dr. Tatum.
What's that?
The comment from Dr. Kashari is up there. Would you like?
Oh, can you read it? Yeah, because I can't see it at all.
Yes, ma'am. Ketoacidosis is caused by lipid, which is fat breakdown, which people choose because it's decreasing your fat content and therefore decreasing your weight. The relation to diabetic ketoacidosis is that the body breaks down the lipids naturally as a source of energy. Hopefully that helps a bit. Thank you, Dr. Kashari.
Thank you. Yeah, and that's what I was like trying to say. Just kind of the difference in like the way it's broken down too. Like one, your body's like actually starving. The other one, like with the ketone, like that actual diet is like you're not consuming the sugar to need to break that down. You only have the fat to break down. So,
ooh, that's real good.
you're silly. Okay, so here are some of the symptoms of knowing like, okay, your blood sugar isn't right. And thankfully, Otis, like you already kind of talked a lot about this. So with the hyperglycemia or like having the high blood sugar, you end up having like the need to urinate even more. That's called polyuria. You become really thirsty, polydipsia. If you're really hungry, it's called polyphagia. And then dehydration or the fruity smelling breath. I will note out of all of these, the fruity smelling breath is pretty concerning because that's actually a sign of the DKA or the diabetic ketoacidosis that we were talking about. So if that ever happens to you or someone that you know, that is a reason to go to the emergency department kind of immediately. And I did want to give you guys just a little bit of information about like the need to urinate more and like why this happens. So basically you end up having more of that sugar in your bloodstream. And because you have more of the sugar in your bloodstream, more of it actually goes to your kidneys and you reabsorb more into your body. And because like you have more sugar, your body kind of wants more of like the water. The water is kind of following it. And so you urinate more. And so because you're urinating more, then you dehydrate yourself. Then as we know, if you dehydrate yourself, just like in the summer, sweating, whatever way you lose more like fluids, you end up being thirsty. So kind of all of this goes like together. And then like for the hunger part, because your cells are basically being starved, you're like breaking down like that, the muscles and fats and things that we've talked about, then you actually end up becoming hungry as well. So those kind of like all tie in together with the hyperglycemia. For the hypoglycemia or the low blood sugar, you can feel dizzy. All of these pretty much, Otis, like I already referred to, but feel dizzy, have low energy, you have the mood swings, you can kind of shake or have like a tremor, just being a brain fog, don't kind of know what's going on, not able to focus, and then sweating. Again, being hypoglycemic is something that's like very dangerous. A lot of people are high a lot of times, which does cause a lot of problems more so down the line. But the hypoglycemia is something that can be very dangerous.
I
Because
just want to add that some people actually go so low that they pass out.
yes,
I just had a friend whose aunt passed out a couple of weeks ago while driving because she had taken too much insulin. So we're actually more afraid of low sugars than we are of high sugars.
yes. And that's an excellent point because I was actually going to mention too. So in her case, I mean, I hope that everything was okay with her. But like the fact that she was driving and someone was able to see her was actually still a blessing, because imagine if this happened right before you went to sleep and you took too much insulin or didn't have proper nutrition before you went to bed and your sugar went so low. Unfortunately, a lot of people pass away too in their sleep because of having sugar that's so low. So I'm not going to touch on this like a ton, but the medications, basically you can take pills. A lot of people are familiar with metformin. I'll mention that. And then injections, you can have injections that may be like not insulin related. Those are ones you can take maybe even once a week. And then some that are like actual insulin. So it just kind of depends on where you are in the progression of the disease, or whether you have type 1 or type 2. So this is the most important part. So hopefully we have a little bit of time to talk about this. So what can be done? Because I feel like a lot of people are just kind of discouraged by having diabetes, and there's really, there's a lot that can be done. I just want to encourage everyone. So the first thing I want to talk about is knowing your number. So sometimes people refer to it as like the ABCs of diabetes. So A being knowing your A1c, where do I actually stand today? And knowing, hey, if I'm not where I'm supposed to be at whatever goal is set, then what can I do over the next 3 months and obviously long term to get within that range? The B is going to be for blood pressure. Making sure you maintain a good blood pressure is very important, because the kidneys also regulate your blood pressure. So if your blood pressure is constantly out of range, then you can basically just spiral out of control, like with your kidneys. And that's how a lot of people end up like actually on dialysis, the combination of having high blood pressure in addition to having the actual high blood sugar. The other thing is going to be cholesterol itself. And so you want to make sure that your cholesterol is within good limits. Make sure that good cholesterol is actually high. Some ways to increase that is like exercise and making sure that your bad cholesterol is low. And that's just like by diet and making sure you're eating the proper nutrition. And then your blood sugar numbers, those are just, you want to know that kind of on a daily basis so you can get a feel for what you actually need to like feel well and to be in the right range. The other thing is if you have diabetes, making sure that you're getting your annual check. So don't go without having your eye exam every year, because again, your eyes are really affected by diabetes, and it doesn't take long. So make sure you go and do that. Your foot exam, that's making sure that, hey, I actually can feel my feet. I don't have that neuropathy or that sensation where I can't feel, because what happens with a lot of diabetics is they end up having like that neuropathy. They can't feel the numbness, tingling, and then they go and they step on, say, a piece of glass and don't know that it's there and end up having an infected foot. And a lot of times, I'm sure we all know people who've had amputations. A lot of times that's because of whether it's the circulation itself or actually having something that's like in their foot and that they just didn't know. It ends up becoming infected. And by the time they realize it, they have such a bad infection that their leg has to be amputated. Microalbumin. And so this is just like a urine test where it shows how much protein you're like spilling out in your urine. And that is also an indicator of how well your kidneys are doing or are not doing. So one thing is you can also is to learn how to read labels, and the labels I'm talking about is food labels. I have like an example on one of the slides coming up, but that's really important. Another one is set yourself up for a success. Make sure that you're prepping. Know what you're like eating for the week. Just don't go by, flying by the seat of your pants, because a lot of times when we do that, and that's diabetic or non-diabetic, anytime we're not prepared, we normally just fall into anything that's quick, which is a drive-through. We end up eating, as I always just refer to it as trash. End up eating that, or just the quick like potato chips, still trash, candy, all of those things. So just make sure you prepare. Exercise and weight loss can definitely be beneficial. The more weight that you actually lose, the more your cells actually respond to that insulin. They become less resistant, and then you can actually take in more of the glucose out of your blood, and you're able to like function. You end up feeling better. You have more energy because your cells have the energy. And then also you're like burning some of that extra sugar. So if you did have extra sugar, you're like getting rid of it by burning calories. Also getting good sleep. Sorry, and somebody's mic is not muted, and I can kind of hear. Oh, thank you. Another one is getting a good night's sleep. I feel like a lot of people don't recognize how important it is. If you don't have a good night's sleep, it just causes you to be like really fatigued. you can have increased cortisol, which is basically like a stress hormone, and cortisol causes your blood sugar to go up. So it's just another way to get diabetes over time, and people don't really realize it. Also, avoid using tobacco, because tobacco can actually cause your blood pressure to increase, and then you spiral into the whole thing about the blood pressure and damaging your kidneys, things like that. And then use your resources. I only put one resource on here, but if you Google, there are a million resources. So this is diabetes.org, and that's a really good resource to kind of start. And then the other thing I said is be happy, because people like that are depressed, again, the stress hormone, you end up having more cortisol, which is that stress hormone. You still spiral into the whole idea of having more blood sugar in your blood, which is still causing all the damage to the organs. So here's an example of a plate that you want to actually have. If you have, this is whether you have diabetes or not, this is always a good idea. So half of your plate should actually be like vegetables here. Other half should be more grains, and that's more of like the complex carbohydrates that I talked about earlier, or like fruit. Don't forget, fruit can go in here too, not because it's necessarily complex. Some of it can be, but because it also has carbs, and this is the area where your carbs are. And then you want to have like lean meats. So there's another picture here. Oh, you know what? Can you guys see me too?
I
Or is it just
can.
mine?
I think that it's going to be dependent upon each person if they can find your picture and maybe pin it.
Oh, I see. Okay. Well, I'll try to show you something at the very end. I do have an example of like an actual plate that you guys can physically buy. You can buy it off of Amazon, wherever. So we'll just talk about a little bit about foods. So the type of carbohydrates, we just kind of talked about that. We talked about complex carbohydrates, but here are like the actual 3 types. Sugar, and that can come from like milk, fruit, and these are sweet treats. These are the ones that you really want to limit, because they're really doing you no good at all. But again, that's not to say never have them, because I feel like Otis mentioned, it's very discouraging when you hear don't. There are a lot of things that you can do. It's just you have to do it in moderation. And then that's why it's important to know your numbers and where you stand. Enjoy a treat every now and then. Just don't do it every day, and just let it be detrimental to your health. Some of the other carbs come from starch, so that can be corn, potatoes, beans, peas, different grains, oats, and then fiber. It's important to kind of have fiber too in your diet. And so here are the recommendations for the food. It's just important to make sure that you don't skip meals. Make sure that you're truly eating like every 4 to 6 hours, because this will help you regulate the actual glucose that's in your blood. And you want to try to have the same amount of carbs, so you'll be able to regulate how much medication am I taking? Do I need to take medication? And those kind of things. Know how to read a label. This is important because you need to also know like how many carbs are in the foods. And then it's important not to skip meals, because when you skip meals, you end up having those low blood sugars, and then you take really basically a risk on your life. And long term, that's also, I didn't mention it earlier, but that's also a reason why a lot of people have like heart disease when they end up having low blood sugar. And it's known that a lot of people will die sooner if they end up having a lot of hypoglycemic episodes. I didn't like put the article in here or anything, but that is something to know. Here is an example, just another example of the plate, like a diabetic plate. And again, I say this should be a plate for anybody, but just half of it being kind of the vegetables there. Then here you have a fourth of it being lean meats. And then the other one is going to be your carbohydrates. And then in the corners here, you can kind of see like the size, like if you look at your fist, those are like serving size. And so I think this is always good to know, because a lot of times we just overdo it. Having too much, even meat, it's supposed to be like the palm of your hands or like the size of a deck of cards. So this is just a good reference for that. And here is a label. So I just wanted to point out this, and it's nice because this label here like kind of points it out. So like, yeah, you want to have your cookies. Okay, I deserve, whatever. I deserve my treat. Here's 3 cookies. But then you decide, all right, I want to go ahead and eat the full container. So it's important to know, like, yeah, you may see that, okay, this is only 170 calories, 23 grams of carbs. I'm good to go. But that's only for the 3 cookies. If you eat the entire container of cookies, you have to multiply that by 4, because you've actually had 4 servings, where 1 serving is what will get you to 23 grams. So it's very important just to know like the labels and what you're reading there, what you're actually consuming, and calculate that into what you're eating. And then this is just a visual. I like this because it's like the reality of how much sugar is in the things that we drink. A lot of people, especially for Gatorade, they kind of think like, oh, it's all good. You know, I can drink this. It doesn't have a lot of sugar. It can have like just as much sugar as like the sodas. And then this slide is just representing like exercise. So get out and exercise. The recommendation is like 30 minutes a day or 150 minutes a week. And this doesn't have to be like exceptionally like strenuous exercise. This can be going out on a walk, you know, do what you can do to just kind of burn some of that sugar off. So I like this slide just because it has like a ton of different exercises, but whatever you like, if it's a matter of dancing, you know, there's just so many activities that you can do. And I say, try different things out. Don't do things that make you miserable, because we all know we do things that make us miserable, we will not continue to do it. So just kind of find your niche, what you like, and, you know, keep moving. So we can do this. Do you guys have any questions or comments? I would definitely appreciate them.
Thank you so much, Dr. Tatum. I want to uplift a comment that Otis offered up in the chat. He shared that lows, when you were talking about how hypoglycemia can be really bad, he shared that lows can be really scary. He said that he's often tends to overtreat at bedtime, causing a morning high after that bedtime low.
Yeah, thank you for sharing that, Otis. I appreciate it.
Oh, no problem. Thanks for having me on.
Sure.
We have a question from the Johnson family.
Yes, I wanted to ask, so a person who, let's say, like I have a friend who was recently diagnosed as diabetic, and I know for some people, of course, it could be scary and unnerving and things like that, but how, like if a person is really like dedicated, like eating right, exercising, like doing the necessary things, how soon like do they visit? Is it like a 3-month, they go back to the doctor and then determine kind of where they are?
Yeah, so they'll go every 3 months to have like that A1c checked, which I think is really great to do, especially at the beginning. So if you're not at the goal A1c, you will go back in 3 months just to kind of check what that number is. And actually, oh, right, that's right. You guys can't see me. I will show you something. I do have like a chart here that I really like. This shows basically the percentage of A1c that you have in comparison to where your blood sugar has been, like kind of on a daily basis, like your average. But yes, to answer your question, they will go back pretty soon after.
But so like if she, okay, and then when the person, but she can, okay, she's already been diagnosed with diabetes, but by diet, exercise, and what have you, medicine or whatever she does, can she be not labeled a diabetic anymore? Like if she gets her numbers where she needs them to be?
Yeah, so that's an excellent question. And that's one that I actually had when I like was in medical school. I was like, oh, so I guess no, they're not a diabetic anymore because they're at goal. So technically you're still considered a diabetic or you have diabetes. But it's just controlled diabetic.
I see. Wow.
Which is still great because there's a lot of, you know, there's obviously life benefits and like really being able to live your full, you know, best life, you know, if you are at goal.
Okay.
So
they're very helpful. Thank you, Dr. Tatum. I am extremely proud of you and honored to be your cousin.
Oh, thank you, cousin.
Thank you.
I appreciate you.
I think that's great. I just want to add too that I think it's important not to own that you have anything. I think language is very important. Life or death is in the power of our tongue. So I've been diagnosed with diabetes. I am healing from, or, you know, like things like that. And it doesn't own you, you don't own it, but it's something like Dr. Tatum has shared can make us better. Because this understanding how to treat your body, sleep, eat well, get your fluids and exercise. These are all things that we should all be doing. But we have some comments in the chat. We have some love from Dr. Kashari and Miss Kathy. And then a comment from Dr. Kashari said that a pediatrician tidbit, talk to the children in your life also about diabetes. So if your children were in earshot, or if you have an opportunity to talk to them before bed tonight, it says that our old understanding that type 1 is for kids and that type 2 is for adults has now turned into a lot of children with type 2. So please, 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 she says, have these same conversations about healthy eating and daily movement with the children.
Good job. Thank you, Kashari. I really appreciate that. Sorry, was there something else?
Yeah, we
So I
actually,
wanna-
oh,
Go ahead, Dr. Ford.
there was another question that had come up before we move on in the comments from Jeffrica Brown.
Yes, please.
Yes, I would just pretty much want to comment. My daughter was diagnosed with type 1 diabetes right during the pandemic. And another great website would be Calorie King. It helps her to count her calories so that she's able to give herself the proper amount of insulin. It was a difficult adjustment for us. However, she has been doing really, really well with being diagnosed, and then her life just changed like with a blink of an eye. Her A1C has been about the 7 range. When she went in, just like Otis, she was about at a 14. We didn't know. It was just a frequent urine, always drinking stuff, but she has been doing really, really well. I think a lot of the information tonight was on type 2, because her doctors are saying the things that she's doing are really, really good. She really didn't change her diet a whole lot because she has to just take insulin over top of the things that she eats. And then she's very active, so that helps. And what we notice when she's like playing her sports, her blood sugar levels range really, really well. But when she's not, then they don't range as well. She also, for anybody that was on it, probably have young children that have it, she has a Dexcom where it helps her to, she can read her blood sugar over her phone, and I can as well. So that helps us a lot as well. But thank you so much for the information, and I really appreciate the invite.
Thank you for sharing that. I think it's
I'm glad
important
she
to note
mentioned-
that with type 1 versus type 2, with type 1, the pancreas isn't creating insulin. So we essentially have to step in and put in and act as the pancreas, because with the normal pancreas, it could adjust to whether you're eating or not, whether you're doing sports or not. Whereas it becomes challenging when you're trying to have an artificial pancreas, like Jeffrica mentioned with her daughter. And so that's why it's a little more challenging to control and bouncing up and down. But I'm glad to hear that her numbers are well controlled. And it sounds like you guys like have a good handle on it, which is really good. And she's learning her body more and more every day. Did
Yeah,
you
that's
say it was
amazing.
Calorie King? Did I miss her?
Yes, it's Calorie King.
I put it in the group chat.
Yes, it's Calorie King, and it helps. It helps to let you know how many carbs are in certain foods, even if we're eating out at restaurants. It helps us to know how many carbs are in the food, so that we know how much insulin that she can take for her food.
I'm glad you mentioned that Dexcom, because having a CGM is very good tool. A lot of times people don't understand how different foods, their body react to it. You could have the same food from 2 different places and it hits you completely different. So one thing I did notice personally is when I had a Dexcom or when I had the Freestyle Libre, it helped me to better track in real time how my body was responding with those different foods. So for someone young, that is very good, or for someone who's having highs and lows, because it can alert you. And if you're asleep, the alarm will still go off. So even if you don't hear it, someone nearby might.
Mm-hmm.
That's great.
Yeah, I really appreciate you guys mentioning the monitor too. So he just referred to CGM. So that's the continuous glucose monitor. So a lot of people know about like testing your blood sugar from having like the one actual monitor. You like stick your finger, put the little blood inside of the monitor, and then you actually see like what your reading is. The ones that they're talking about is basically you wear it all the time and you're able to check your blood sugar all the time without having to like continuously poke yourself in the finger. It does still have a needle attached to it, but it's my understanding that it's not like painful and it's like much easier to wear. So, and I don't know if you guys want to like actually speak more on that, but I did want to just bring that up since a lot of people are probably like, what is this they're like talking about?
Yes, and you have a number of questions and comments in the chat, so we want to be mindful of time. I do want to share though, isn't there a tool, Dr. Tatum, that doesn't even use a needle anymore? It's just the speed of air that it will poke your finger. Are you familiar with that?
I am not.
There is.
I know more so about like the Libre 2. What's that?
I was just saying I don't know the name, but I know that there is a tool that will draw your blood that, or not draw it, but get enough blood to test that doesn't even use a needle. It's just the speed of air that'll be able to prick your finger without a needle. So Shantae Stewart in the chat says, can you talk about the myth related to weight? She adds that just because you are not overweight does not mean that you're not still at risk for being a diabetic. Can you speak to that?
For sure. Yeah, I mean, and so that still goes back to the same like mechanism we talked about before. Is one, just imagine somebody that's like basically living a sedentary lifestyle, which means that they're kind of sitting around not actually burning that sugar off. Some people still have like a higher metabolism, but if you're not actually like getting rid of that sugar, whether it's through physical activity or not like actually eating as much, you're still damaging the same organs as you are otherwise. You know, it's just the fact that people that are obese have an increased chance of doing that even more. And specifically people that are obese, like and have larger midsections, because there is more like fat around there. So you have more of that fat and that's causing your cells to be even more resistant. But absolutely people that are smaller, if you're just not living a healthy lifestyle, you can still have diabetes. And I don't know if Dr. Ford, Dr. McCullough, if you guys want to touch on that anymore, but.
I think you wrapped it up well.
Yeah, so it looks like we have all of our questions asked and answered. We got a lot more love for you in the chat, Dr. Tatum, so hopefully you can take a look at that before we close out. But if you'd like to close us out with any takeaways or shouting out any additional resources or repeating anything, reiterating it, we have a couple more minutes left.
Okay, and I'm actually going to stop sharing my screen so you guys can see me a little better for those that cannot see. Give me just 1 second. New share, just kidding.
While you do that, I just want to echo Kashari, Dr. McCullough, when she mentioned or advised you guys to talk to your children, because our goal is to create generational health. And it really starts young with diet and education. And the childhood obesity rates are going up, and in turn, as maybe not a direct correlation, I'm sure it's a combination of diet and lack of exercise, but our kids are also being diagnosed with type 2 diabetes at a younger age. So if you could start, planting the seeds in your children's head, instilling good eating habits, and of course, increasing exercise. I know it's really hard. We have iPads and electronics everywhere, so kids don't play outside the way they used to, but encouraging your children to move.
Yeah, for sure.
I think that's great. And I just want to just a little bit, this is a family thing. Like Dr. Ford said, it's about generational health. And so let's do this as a family. So if any of you have been diagnosed or if we're just desiring to be healthier, our children can be great accountability partners. They are honest and they will let you know, oh, mom, dad, sister, we're not supposed to eat that. And let me tell you, they love, even though there's technology, if you go outside and play with them or go outside and walk, that's exercise for you and them. That's the entire family, and it can go a long way.
So true. Oh. And then there's a couple other things. It's funny, sorry, my little cousin Kendall's on there. You guys can see her. And every time my cousin is, my older cousin, her mom, who's right there behind her, is like on the treadmill. It's a perfect example of she wants to get like on the treadmill. So don't take for granted that your kids do what they see, and it will become like lifelong habits. So keep doing the right thing. They'll keep doing the right thing, and they'll live nice, healthy lives. before, I know it is like 8 o'clock, there's just a couple things I wanted to show you guys that I wasn't able to show you before. But here's an example of a plate that you can have. And this one actually says like vegetables, protein, and grain in it. So, I'm sorry. Okay. So yeah, so this is just like an example, but you can get these off of like Amazon, and they're great because then you don't have to think about like, oh, let me see exactly how much it is. Here it is already portioned out for you. Another thing is, if you actually do, or you have been like diagnosed with diabetes, there's a sheet. And if you guys want me to like email this to you and or send it like by mail, I don't even mind doing that. There's a sheet too where you can have this like on your refrigerator. This one is actually made by the hospital that I work for, but it could show you, hey, you're doing great. Basically, let's kind of watch out for things. And then here in the red zone, hey, you need to go see your doctor like immediately. So this is also a very good sheet based on like your symptoms, also based on your just your actual numbers that you have. And then the last thing, just because I had mentioned it earlier, A1c, if you guys happen to want this too, this is just a sheet kind of showing exactly what your A1c is and how your blood sugar itself has been running. But that's all I have. I actually do have more resources, but it is time. And if you guys have any questions, you can reach out to the website, rgenhealth.org. Send emails there. I can answer stuff if need be. Dr. Ford, she's on top of it. So.
Yes, thank you all for joining us. We will have another session next month. We do this once a month on different topics. If there's something that you'd like for us to cover, please let us know. Send it to the email that Dr. Ford's going to put in the chat, and or just talk to the person that invited you. We're so grateful that you joined us, and we look forward to it next month. Please continue to be healthy. Let's end this year strong and start the new one even stronger. Enjoy your evening.
I just wanted to give a little like preview a little bit. Next month, the plan is to talk about inflammation. If you guys all want to join in, the date is to be dated. We'll have it up on the website the moment we decide on it, which should be within the next couple of weeks. But thanks everybody for coming in. I hope that if nothing, you did take away that we all need to exercise and eat a little better.
What was the topic for the next month?
Inflammation.
Thank you.
All right, you guys can log out. I think so for the people